New coronavirus variants, more contagious and more dangerous. Hey everybody, it's Dr. David with another Ask Dr. David video for you. We've been talking a lot in the office around here about the new Omicrons that are going around. And I don't know about you, but I now know more people currently or who had just gotten over COVID at this point, this week, than at any other point during the coronavirus pandemic. And we think we know why. And so I'm going to share this information. Now, as you have probably heard, these new variants, BA.4, BA.5, I haven't seen a lot of differentiation between the two of them. They are rather similar. But what we are seeing with them is a few things. Okay. Now, let's talk first about contagiousness. Now, the way that contagiousness is talked about in numeric terms is what is called R naught, which is an R and a zero, not as I think the way the British say it. I think it's a term that came from them. So basically, an R naught of one means that for every one person who catches the virus, one additional person will catch it. So when an R naught is under zero, that means things would be less likely to be spread. And the higher the R naught, then the more contagious that it is. Okay. So when so for instance, if there's a two, that means there's two people who would catch it for one. Now, the original coronavirus that from way back at the beginning of the pandemic and the early 2020s, that particular one had a R naught of 3. That was the Wuhan strain. So that meant every one person who got it, on average, 3 other people would get it. Now that doesn't mean that that one person gave it to 3 other people, because that means that that one person could have given it to another person who gave it to 2 other people, etc. So that's kind of the way that that number goes. And for a point of comparison, for influenza, it is actually between 1 and 2. So the original Wuhan strain was more contagious. But here's where the story got more interesting. As we got to Delta, the R naught was 5. Then when we got to the Omicron, the original one, the R naught was 10. Now, with the new Omicron BA.4 and BA.5, it is 18.6. So for every one person who catches it, 18 other people will test positive due to a direct or indirect contact to that person. Now, the R naught for measles, which is considered the most contagious of the viruses that are in circulation on this planet, is 18. Actually, it's 16 to 18, which means that the new Omicron subvariants are the most contagious known viruses on the planet right now. Okay. And of course, that's why we're seeing so much of it. Now, the other part of this also is, what is it acting like? What are the symptoms that it's causing? Because the original virus, if you remember, that there was concern about going into the lungs, and with the Delta, it was actually more going into the lungs. But then when we got into Omicron, the original ones last winter, we were learning, oh, this was a milder, although more contagious form. It wasn't going into the lungs. It was really mostly staying in the upper respiratory passages for most people. Now, what we are seeing is something different. Now, there's two pieces of information. What they did is they have cultured lung cells. So this is human cells on a petri dish. And what they can do is they can expose the virus and they can see how much it sticks to and infects and then goes from one cell to the other. And we are seeing that this is where it's similar to Delta. With these new Omicrons, it's infecting those lung tissues, at least on the petri dish, in the same way, much more. And that obviously, if it's affecting the lungs, lower airway disease, the acute respiratory distress syndrome, the pneumonias that can happen with the fluid that builds up in the lungs and cause much more respiratory problems. The other thing that they did was they actually, and throughout this pandemic, hamsters have been the rodent that's been used to replicate what's happening in the human body. They found a lot of similarities with that. And with this, they are showing that that the infection and the mortality, the severity of these hamsters are actually what we were seeing back in Omicron, I'm back in Delta, not what we're seeing for Omicron. So it seems as if we're dealing with both a more contagious and a more dangerous version of Omicron, which of course means we have to have our guard on, right? This isn't where we were thinking 6 months ago, oh, if I catch Omicron, it's no big deal. It's just going to stay a cold. That's not what the data is saying. Now, of course, over the next few weeks, we are going to see more data coming out about this, but these should be striking some alarms. Now, I want to also talk about the antibody production. And there was a study that came out in the past couple of weeks where they looked at people who have had the vaccine as well as people who had the vaccine plus wild infection, that hybrid immunity that we were talking about. Okay. And I want to share the numbers. And unfortunately, what they didn't do in the study is look at people who just have had Omicron or had COVID, but not vaccinated. Because as we'll talk about, there was more protection seen with the hybrid, but it would have been nice to see how much of that relative to just being vaccinated. But it would have been nice to see what did the past infection do without having the vaccine to really look at all of that data. But basically, here's what the numbers showed. And I'm going to have to refer to my paper here because there's a lot of numbers here. So, with 2 doses of the vaccine, 6 months after the vaccine, the titers that were being produced against Omicron that would actually stick to it, that would serve in that way to flag the immune system, compared to the original Wuhan variant and then the Delta, was 83% less. So only 17% as protected for people who just had two. Now, with 3 doses of the vaccine, so the person who had the booster, now, and this it was 2 weeks later on average, they did show that there was a huge increase in those stick toing it, those neutralizing antibodies. Okay, and it was like a numbers like thousandfold more, pardon me, hundredfold more. But they also showed that compared to the stickiness over time to the original variants, it was still 21 times less. Okay, so it did so the booster clearly did show an improvement, but still compared to the original strains, not so great. Which of course we've known that because we've been seeing this what we call immune escape, where the viruses are escaping the immune system, and that's why people are getting sick again. And we're hearing a lot of people who, not just from back in Delta, but there's a lot of people now who had Omicron back in the winter who are catching it now. All right, you probably know somebody. We all do right now, but that's that. Now, for those who were vaccinated and had the virus, those people have twice the amount of protective antibodies compared, and again, this is to the Wuhan strain, but where there is some coverage and protection compared to people who did not have the virus. So there is a doubling in the protection if you have that hybrid immunity, which is obviously good to know that, and certainly why we do seem to see almost overwhelmingly, if a person does get Omicron or, is getting Omicron and had the virus previously, that those people do have more mild disease. And that's good for, of course, to know as well. But so overall, what does this mean? We cannot let our guard down. That means that, starting our COVID immune protocol, as we've shared many times before, and again, it's in our Patreon. That's in our Patreon and our patient portal for our patients. You'll find it on previous videos as well. Starting the moment that you're exposed to somebody, because if this is as contagious as measles, if you've been exposed, unless you've had Omicron or the vaccine like in the last month or two, you're probably going to get it. So start up right away. Don't ask any questions. Any symptom, test so that you know. But a lot of people, myself included, the first 2 days of symptoms don't show positive. For me, it was not until the third day of symptoms, and that's when I spiked my fever. That's when I had the rapid test being positive. I confirmed it with the PCR as well. But of course, we've also talked about the use of oral prescription medications for treating this, right? And so I think that that I would be quick to jump on a prescription medication in order to do this, especially if you are in a high risk group. Does a child need to be taking it if they're 12 and above? That's what it's approved for. No, but I would be considering it in anybody else, or if there was a child even over 12 who was getting more severe symptoms. I personally did take Paxlovid. A lot of people that I know more recently have. I've had people tell me within 12 hours of the first dose that they're getting significantly better. So that's kind of good information. But prescription medications do it be something that I would be starting up. All right. Well, hope that gave you a lot more information. I know that there's a lot to unpack there. but hopefully you've learned a thing or two. And of course, please share this video with other people. This is information that a lot of people don't have yet. And of course, if you're not joining us, haven't joined us yet, and subscribed to our social media, to our YouTube channel, hitting that notification button so that you will know right away when we put another video out, then you'll know. All right. Well, to your health. Hope you do well with all of this. Hope you stay away from it, but at least you now have the information to make the decisions you need. Have a nice day.